Ben in particular felt he had to live his life at 1,000,000 miles an hour so that he didn't have to stop and let those demons come into his head.
This is Chris Brown. 2 months ago, his son Ben took his own life. He was 22, studying engineering, and months away from starting with the army. Lockdown made things difficult for Ben, but his dad says it was only one of many factors which influenced his feelings before his death.
Lockdown, of course, gave him a lot of opportunities, I'm afraid, to just sit on his bed, lie on his bed, and let those demons play with his mind. It all goes into slow motion when she starts putting the words out, "It's our son, Ben. He's killed himself." And it just slowed right down. I've never felt this feeling of I couldn't stand up straight. I suddenly had to lean against a table, my legs were going, and I was just shouting no, goodness knows how many times, down the phone, and probably a swear word as well.
To his parents' knowledge, Ben was never diagnosed with a mental health condition. His dad says he didn't show any outward signs of his suffering. He was just one of many struggling during the pandemic. The charity Mind are calling on the government to start planning now for the deep and lasting scar that they say will be left on the country's mental health.
Other professionals and volunteers have had an escalating number of calls and people in acute anxiety.
So I've been speaking to a whole host of charities for this film, and they've all said the same thing, that as we come out of lockdown and in the coming months, we're heading for a mental health crisis.
We normally have a lot of people maybe mentioning suicide, but almost a third of our callers have been talking about suicidal plans. And we actually predict there will be a tidal wave of people who are going to need help and that the mental health services are not going to be able to cope.
He was a very bright and colourful character. He brought like a big energy to any room that he came in. You would always know he was there.
For 34-year-old Daniel Furness, the very prospect of lockdown was overwhelming. Daniel had bipolar disorder, and just days after the lockdown was announced, he voiced his concerns online.
I messaged him kind of on the day that the announcement was made and said, you know, I understand that this is probably going to be very difficult for you. Please just reach out to me anytime you need to chat. He wouldn't give it away how much he was kind of struggling. My sister would send him like kind of Snapchats every morning of our little niece because that really brightened up his day. She was a bit like a natural antidepressant for him.
But the day after posting that Facebook update, Daniel was found dead.
My brother called me, and I think his words just were, he's actually done it. Lockdown was just probably one of many factors for him, and it was just unfortunately something that obviously just intensified it far too much for him.
The government first published advice for people with a mental health illness on March the 29th. That was 2 days after Daniel was found dead. We went to the Department of Health and Social Care with Daniel's story, and I've just got this email in response. I'll read you what they say. They say they've given just over 4 million to mental health charities like Samaritans. And this is on top of 5 million already made available to charities through the Coronavirus Mental Health Response Fund.
The system has been under a lot of strain for years, so it was already very much up against it. So there is already evidence that there's going to be an increase in levels of mental illness. If you're feeling suicidal and you feel that there's nobody you can turn to, I think it's very important that people actually make contact with somebody that they trust, get some immediate support. If you're really in crisis, you can contact your GP. Mental health services have got crisis lines. If you don't know the number, you can go through 111. And of course, you can always speak to organisations such as the Samaritans.
Even if you're surrounded by family and friends, in ordinary times, it can be a distressing, isolating factor to be thinking about suicide. But I think lockdown has compounded that. People are reporting that they don't have the normal support channels open to them, and a lack of privacy as well, being actually in the house surrounded by people who care about you but are not necessarily the ones you want to disclose difficult topics to.
Chris's son Ben was a vocal advocate for mental health. Just a month before taking his own life, he posted online to encourage other men to discuss suicide prevention. For so many of his friends, he was their guy to turn to when they were feeling low.
You gave me the biggest hugs ever. You could see through my mental health and suicidal pain. Who knew that the person who really needed help was you too?
That was especially true for Aze Hussain, a spoken word poet and one of Ben's university friends. He's been diagnosed with clinical depression and generalised anxiety disorder.
Corona's already affected me heavily in terms of death. Lockdown got me learning self-love, and now it's reversed. I could have been Ben a few years ago. If it wasn't for people like Ben and my friends telling me to seek support and counselling, then I wouldn't be here. I wouldn't be speaking to you. Yeah. I won't be around the bush. Lockdown is the worst. I wouldn't wish this pain upon my worst enemy. The pain of waking up every morning and feeling like you just want to go back to sleep. That pain of suddenly wanting to open up but then closing it all in. That pain of thinking that no one will miss you and feeling as though you're a burden on this world. I wish I could have helped you. I should have seen the signs. Man with the happiest smile on me, he's reading between the lines. Take it from me. Take it from Ben's family. I beg you, reach out before you have to feel this agony.
Suicide is such a complex issue, and it almost never happens just because of one reason. Lockdown may have added an extra layer of difficulty to Daniel and Ben's lives, but there's no way their deaths could be attributed to just that. And for their families, they have to live with the loss for the rest of their lives.
I've just got through Father's Day. That was the strangest experience. Christmas, birthdays, they're always going to be challenges forever now. We would sit at the table and watch the red kites up in the sky above us. And he'd look at them and say, they're magnificent beasts, aren't they, Dad? And I said, yeah, they are. And it's strange now, when I see them swoop over low over us, I see Ben now.